Hey, Greg Spindler here. Many of you are treating people with back pain and so forth. It's easy to do releasing the psoas, the QL, doing some quad work, that sort of thing. But there's also some things that we got to think about. What's the next step if that stuff doesn't work? We have what we call the SBS mechanism in the body, and it's right here between the purple bone and the yellow bone. And you see physical therapists working with modifying the McKenzie because we have an issue in the spine and its relationship with the iliums. So they do the McKenzie press up. They have to modify it. So the reason why they do that is because there is a spine postural situation. So if we just do a regular McKenzie press up by locking the quads and the elbows come up and we just go straight up, come on up and back down. You do that for a series of times and you're hoping this area here in the low back improves. Sometimes they have to modify that where they create a torsion in the spine by rotating the sternum and then coming back up. Now they're doing the McKenzie press up with a modification of torsion. Then some people have a side bend in their posture. So they make a side bend, they'll turn the other way and come back up. Good. And back down. So that's a McKenzie with the side bend, McKenzie with the torsion, and then we have the straight up and down with the flexion. But what happens here in this SBS mechanism, that's where postural patterns all start. If I take the occiput and the sphenoid bone, I'm going to show you, they come together, right? They come together. If we go flexion with the two bones, that represents flexion. If we go backwards, that represents extension. And that resembles way down here in the low back, in the SI joint. So if we go side bend, we have a side bend, meaning it's tighter on one side in this SBS mechanism, and it opens up. You're going to need to come around here if you can to see the posterior side inside the cranium on how this works. So when someone's stuck in flexion, meaning here, we have an open space in the SBS mechanism to where it's open on this side and it's hard to go into extension, representing it's hard to go in extension in the low back. So as manual therapists, we can clean this SBS mechanism up by going in and out directly and indirectly. If someone is in a side bend pattern, which means this area is closed up on one side and opened up on the opposite side, meaning they have a jamming effect in the side bend, creating that side bend posture in the low back. The opposite is the other side. We have an inferior strain pattern, which means the occiput goes further inferior, so they get stuck here. So we can clean that up as well. So we have flexion, extension, a side bend, a torsion, which the occiput and the sphenoid go in opposite directions. So you can see what happens here, which creates a torsion in the lumbar sacral area with the iliums. So many times, the last little step to get out of low back pain is right here in this SBS mechanism. Have a great day. I'll see you in class soon.